So GSP should be ingrained in all healthcare scientists' minds. So why do we use good scientific practice standards for the STP rather than health and care, or should I say HCPC standards of proficiency? And that's the question we're often asked for clinical scientists. But GSP covers all healthcare scientists, but basically, why do we use those standards? And if my slides were doing the right thing, I'd go in the right order. Oh, this is very strange. Anyway, so what are GSP domains? The domains are professional practice, scientific practice, clinical practice, research and leadership. So they're the domains of the good scientific practice. And these are standards that have been designed and reviewed by healthcare scientists. And it was done in 2012. And we've used and developed them, reviewed them, and they have the language that is specific to healthcare science and the healthcare scientists. So when we look at the HC standards of proficiency, the generic standards have to meet the needs of 15 professions that HCPC regulates. And it's not always applicable when you read the standards. So we developed the GSP to come into our own language. The terminology, the language of each standard is so important because it meets what we do, how we work, and it comes from us and are for us as a workforce. So it's really important to have standards of our own. So we can adapt the GSP standards quickly. We can respond to change in regulation and in terms of good practice, particularly if you talk about HCPC standards, they will review theirs regularly. And we can adapt our standards to make sure we always meet the HCPC standards of proficiency. Sometimes the PSA will give guidance as to what we ought to include in good scientific practice, and we can do that quickly. And because we can respond quickly, we can make sure all our registrants, applicants, and trainees always meet the standards that are required for health and care regulators. So we have this confidence in GSP, they're our standards, and those standards that we cover all our daily practice. So demonstrating you meet those standards of professional practice, scientific, clinical, research and leadership means that you put the patients at the centre of your practice, even if your role isn't patient facing. And I can absolutely guarantee to you, any of you that are out there, even if you're non-patient facing and are never likely to see a patient face to face, you will always be able to meet the standards because that patient is represented as your barcode, as your device, as your data, because they've all, at the centre of that is the patient and they've given consent for you to be undertaking investigation, etc. on their behalf. So the patients are at the centre of our practice, and which is why GSP is at the centre of our practice. We make sure that you've undertaken adequate periods of supervised training to when you the responsibilities are comparable with other healthcare scientists. So what we need to do when we're talking about GSP in terms of equivalence is that we make sure that if you're going through the equivalence process, that you meet the standards of a clinical scientist with experience of at least 3 years, at least band 6 or 7, and you're comparable to the graduate of the STP training programme at the National School. And we make sure that meeting those standards, you've got the knowledge, skills and behaviours achieved through your education and working experience. So you have to have those working experiences documented and evidence to meet GSP. And so they're always comparable to somebody that's coming off a National School Accredited Scientist Programme, be it PTP, STP or the higher specialist programme. So this comparability, this equivalence to a curriculum and other healthcare scientists is essential, that so that you can demonstrate that you are equivalent to another person in that field. So demonstrating GSP, you can apply your knowledge and skills and behaviours in clinical settings. So that may be face-to-face, as I said before. It could be in an MDT. You can demonstrate it in an educational or academic setting, but you can apply the skills, the appropriate levels of skills and behaviours according to your role and your scope of practice. You've reflected on your training. That's one thing that you have to do, not only to meet the standards of GSP, but when you go on and you're registered with the with HCPC, it means that you can submit your CPD that's required with HCPC in reflective form, and that's essential. So having reflected on your training and experiences and how you learn and how you develop is key to being a clinical scientist and a healthcare scientist in the other groups as well. So being aware of the relevant legislation, the risks involved in your work, the approaches to risk management, QA, and the accreditation process, it mitigates, everything's mitigated to uphold the health and safety of all parties, whether it's staff, trainees, but particularly patients. So HCPC makes sure we meet the standards, as the we meaning the academy meets the standards. So every 2 years we go through a rigorous performance review, and the certificate of equivalence programme that we put forward to HCPC demonstrates that we've got a programme of comparative and retrospective assessment in terms of education and training of our applicants. And so we have to demonstrate to HCPC that we meet all their standards. And for to be eligible to go through STP, they must be employed, be able to demonstrate that working at the level of a clinical scientist, be involved in complex and scientific roles. And these are sort of is the job description, if you like, of a clinical scientist. But again, as I say, the GSP standards apply whether you're doing PTP or STP. But in terms of the HCPC performance review, it's essential that we can demonstrate high standards to meet their high standards. So we set out our standards of proficiency and GSP as a benchmark for education and training providers, and we establish threshold standards. So we make sure that what we give as guidance for standards and GSP meets everyone's minimum standards, and the outcomes of our activities have to be reported to the education, the Academy's Education, Training and Standards Committee, which reports to our regulation boards. So you can see, not only do you meet standards, but we have to meet standards appropriately and at high level. And so through this, the use of the standards in our processes, we can help to assure that registrants, learners, applicants completing any of the programmes or are sufficiently educated and trained to be able to practice safely and for the benefit of the patient and the public. And that's key to everything we do every day. So if you're, whatever your skill, whatever your specialty or modality, we have to make sure that to go through any of our processes that you meet our standards and the HCPC and the national school standards for safe practice. And we can be assured then that we can meet the expectations of the patient and public. So in other words, the Academy works really, really hard to demonstrate to you, HCPC, that etc., that our standards alongside GSP are used for the foundation of your professional standards and for your safe and effective patient care. So when we ask you to go through the processes, the equivalence processes, etc., we are checking you against our standards, and we are looked at by HCPC and PSA, and particularly by the patients and the public, to ensure that we've got the highest professional standards that there are. So there's not much more I can say about standards such as this. And I think it's probably best you ask questions about standards and the things that worry you perhaps about the processes that we have in the Academy. But I'll leave you to ask the questions, because I think it would be nice to hear what you've got to say and me answer your questions and make me work for my money. So I shall leave you then. You can have these slides, and there's some there's a slide at the end with some website and details and etc., so that you can contact us.
Great.
So Mark.
Yeah, thanks very much, Lynn. That was
No
a brilliant talk, and yeah, we'll make sure if you send the slides over to me that we get those posted up so that people can get hold of those. So I'm looking for yellow hands or otherwise questions for Lynn.
And I love questions.
That's good. Lynn did say before she started talking that she wants some questions. So, I mean, I've got a question then. So it seems to me that your GSP, your standards then are applied to both education providers and also to individuals who are going through those equivalent processes. Yes. So, so in the context then of education providers, are they used to perhaps accredit programs, degree programs and HEI programs?
They are, and they're also used within, embedded in the programs themselves. So the national school adopted the GSP standards as a foundation, if you like, for the programs. So there's equity across all the specialties. We have all the same standards. And then the specialty or the discipline specifics are applied against these standards, so we know that all healthcare scientists work at the appropriate level to the required standards, and that's really reassuring for all of us, particularly the patients.
Yeah, that makes sense. So they would be embedded then in the curricula for the programs, and I guess from an individual's point of view, for somebody going through the equivalence process, can you talk a little bit more about what this means in practice for them? Do they have, your standards map out through a table, don't they? Yeah. So you can read, these are all the standards you need to meet. So what's the practical process that people would need to follow to demonstrate equivalence with those standards?
Well, if we talk about STP, clinical scientist, for now, because for me that's the easiest thing to describe, is we've just written all we've formatted a template against the GSP, so applicants actually write to each standard and have to provide evidence to show that they meet each standard. So it's very prescriptive now. previously, applicants wrote their own story. And everybody has a way of writing a story, and it can go slightly off-piste sometimes and have a bias towards things that perhaps are important to them, but not demonstrating what they should be meeting in terms of content of a portfolio. So we decided that a templated form would make it more prescriptive for the applicants to write to, but very importantly that the assessors, there's consistency in assessments, and there's also guidance as to what sort of evidence is appropriate for the applicants.
That's brilliant.
The other thing is if you go to the apprenticeships, they have, well, in fact, all the healthcare science programs have adopted, have got the standards there in a format or other, so we can be very reassured at the consistency of what people are writing against.
Yeah. So they map across lots of different programs by the sounds of things. And who does the assessment then, Lynne? So if, let's say I've applied for SDP equivalence, and I've done my mapping against your GSP. So who then makes the assessment that I've met the standards?
So after the initial admin side of things, that you've met the standard in terms of the qualifications, the years of experience, etc., and the right banding of, then the people, that's the admin side, and then we have specialist assessors who are from the professions themselves, and the professions vet the CVs of all the assessors to make sure that they're meeting the professional body standards. So the specialists have been approved by the professional bodies. They've met our standards in terms of how they assess. They go through training. So we're so reliant on the professions themselves. So it will be a clinical scientist assessing your portfolio. When it comes to the, if there was say, a less than perfect portfolio submission and there was some work required, we would then have another clinical scientist who would look at that as a moderator, and they would look to see what the issues were and if the advice from the specialist was appropriate and at the right level, etc. And they then that applicant would then have to provide work and more evidence to meet the standard. When it comes to an interview, there's 3 people. So you've got a professional specialist, you've got a moderator who could be a clinical scientist in any discipline, and you have a lay assessor who represents the patient and the public. So
that's brilliant. So you've got a triumvirate approach really then, with lots of different skills to making that assessment. Yeah, that makes sense. I can't see any other yellow hands yet. Don't be shy if you've got a question. I've got another one here, one more. What about training the trainer? So let's say I'm now a training officer or a supervisor, and I'm trying to, to take some of my trainees through the equivalence process. Is there anything that I could do to help me understand how they meet those GSP standards better?
Okay, well, the National School have training for trainers. That side of thing is obviously to do with the programmes, and we don't interfere with training for trainers. But as far as our assessors are concerned, we have training updates, and we ensure that each individual meets the professional body standards in terms of their CV experience, and that they're obviously HCPC registered as a clinical scientist at least. So the appropriate person assesses the portfolios, but in terms of training the trainer, then that's left to the school.
Brilliant. That answers the question really well. Thank you, Lynne. Great. Okay, I can't see any hands. Oh, There we are. We have a hand. Thank you. And this is Nessie from Maidstone. Hi, Nessie.
Yeah,
oh,
Mark,
wonderful.
just to say, there is a question in the chat. This is what I want to say.
Oh, I'm sorry. I had
okay.
the chat up originally, and then I switched to participants so I could see the hands.
Yeah.
Thank you. So this is Akash from UHS Sussex. How is the AHCS equivalence scheme different from ACS Route 2?
The key thing with the Academy's route is that we have the curriculum that the applicants have to provide evidence against. So it's absolutely key that people applying through Equivalence meet Equivalence to an accredited programme. The ACS route 2 may use that as a guidance, but there's more, it may be more flexible in terms of the standards that they meet, but we are always tied to a curriculum, and that's the main difference. Route 2 very often is, in my mind, is excellent for people that have different jobs, slightly different roles, and or for perhaps those that are more academic, they've gone through more research. But for people who've got years of experience or have gone through a training programme to demonstrate that they're equivalent to the STP graduate, you need a curriculum to use, and that's where the Academy excels, because we have the curriculum guidance as to how they meet the standards in that respect in terms of content. So we always assess against curriculum learning outcomes.
Yes.
If that helps.
No, that really helps. Thank you. And those curricula are very well established, aren't they? And reviewed on a periodic basis too.
They are.
Great.
I don't know if this helps, Mark, but I'll just mention that we do have drop-in sessions. So if anybody doesn't get a chance to ask a question, they can always come to the drop-in sessions at the Academy.
That is brilliant, Lynne. Actually, if you can send me the details of those, then we'll make sure we get those advertised out to people. We can put it out on the Healthcare Science Network, for example, so that they're visible and people can join those. That's really helpful.
No
Sarah from East Kent has a question.
Hi, Mark. Hi, Lynne. Thanks for the presentation. I just wondered what the approach might be if there was someone who was looking to do the equivalence, but didn't necessarily have the masters in the same way that an STP would. Is there additional requirement for, I don't know, to demonstrate the level of knowledge or a project, or how would that be managed?
So it is quite difficult to get your head around that, because it's master's level equivalence, but it's in terms of years of experience, or it may be acquired through different, applicants may do a master's, but it wouldn't be something absolutely that the professional body would require. It's an accumulation of different types of experiences, whether they're academic, experiential in the workplace. We don't stipulate a master's, but it's master's level learning that you've got to demonstrate, if that makes sense.
Yeah, that's great. Thank you.
No problem.
Yeah, so it's there's some flexibility built in there, I think, by the sounds of things. Yeah, which I think in the modern world, to be honest, is helpful, isn't it? You know, I've had people come through many programs, some of which non-academic, but they've managed to achieve that level of expertise, knowledge, experience, education through other routes, and so it's really good to be able to piece that together, I think.
And that's the joy of equivalence. For me, that's the thing the reason why I think it's a fantastic way to go through and, to become a clinical scientist. It's marvellous.